So first is, where does the low grade start? Yeah, still very controversial. Yeah, there some people think maybe it's from the fallopian tube, or some people think maybe some cell trapped into the ovary and then become a cyst and then become a benign adenoma. So still controversial. Yeah, but if we, all of them, but we still don't believe all of them are from fallopian tube. But for sure, they are from some cyst within the ovary, or cyst adenoma, or some early stage inclusion cyst in the ovary. So this picture is the borderline tumor. So you can tell, like, why they call it borderline. So the darkly stained cells are the cancer cell, right? So they are in the border, and the middle part actually is the normal cell. Yeah, so it's in the, like the cyst, and then some cells coming out. So the normal cell is inside, the cancer cell is just in the border, so it's borderline. Yeah. So we found that some of the pathway like KRAS mutation, BRAF, and some of the ERB2 signaling is deactivated or deregulated. And then during the progression, we characterize some of the low-grade and borderline tumor. We found some of the genes like PAX2 and AGL3, and KRAS mainly, and MRAS will be found in those later stage borderline tumor. And there's some literature looking at like how the patient doing after. I mean, some center, they follow the patient very long, like up to 36 years. Yeah, very impressive. Yeah, so it seems for late stage borderline, about 20%, they will recur as borderline. So when they recur borderline, I think it's okay, right? But still it's borderline, so yeah. But for some of them, they will recur as low grade. So if you look at, like, even this is, although the cancer cell is proliferating, but the cancer cell is stay at the borderline, at the outside. So the cancer cell did not invade or go inside the normal cell. But when it become a low grade, you can tell all the normal structure got destroyed. So all the tumor cells just grew inside. Yeah. So, and we analyze a lot of those patient sample. Yeah, not a lot, but a decent amount of cancer cells. So those are some new mutations that we have identified, like the DNM3, UBR5, and we also look at, we sequence the RNA. We literally sequence tens of millions of RNA molecules in the tissue, right? And from those RNA, we can tell this RNA is from gene A, this RNA from gene B, so we can construct computationally what kind of pathway is deregulated. So here are some of the pathway we think is deregulated in low-grade serous carcinoma. Yeah, like the mTOR pathway, I think STAR also funding Oklahoma to work on the mTOR pathway, see whether targeting mTOR may benefit the patient. Yeah, and the IGF-1 I just mentioned, yeah, we also found that one, but not able to further test it.